has been asked by Governor Strickland, by the Senate President, and by the Speaker of the House, as well as by the Supreme Court, to work with those of us in Ohio in a bipartisan, interchamber, interbranch effort to look at our correction system and to see how we can make sure that we're doing the best that we can to use taxpayer dollars in an effective way for corrections and to improve public safety. Today, the Council of State Governments Justice Center has released a report. The report addresses the correction system and suggests that there are ways that we can improve our use of taxpayer dollars and improve public safety. We want to make sure that we're doing the best that we can to use all of our systems to reduce reoffenses or recidivism and to lower the cost of our correction system. We have a number of people here this morning who will address any questions that you have, and I'm going to turn it over first, I believe, to Dr. Tony Fabello.
Thank you. Thank you, Representative Moran and Senator Seitz and Justice Stratton. Just in a nutshell, like Representative Moran said, I think Ohio has a very strong infrastructure of programs, and we need to build upon that to improve them. The challenge that we're facing in Ohio is a large number of what we call here felony 4 and 5, which are low-level drug offenders mainly, that are coming in and out of prison, not staying there long enough for them to benefit from any of the correctional programs, and consuming about $189 million a year of prison space. The idea is to find strategies to deal with them more effectively by better targeting the programs that are already in place in the community diversion programs, halfway houses, community-based residential facilities, and also improve the probation system. Ohio, unlike other states, like my home state of Texas, does not have statewide standards for promoting evidence-based practices for the probation system. That's an area that we're recommending the leaders here to explore more carefully and look at the possibility of setting standards to promote evidence-based practices that eventually will get better results and reduce recidivism. And that's the foundation of everything, underlying the fact that the majority of offenders are under supervision in the community. They're not in prison. Almost 200 and some thousand offenders on the probation system. Whatever happens with those systems is very critical to improve public safety in the state of Ohio. Related to that is the whole infrastructure of mental health services and substance abuse services. And I let Dr. Osher, who is the director of our behavioral health team, to come in and give you a nutshell on that.
The issue as it relates to behavioral health is that there is an overrepresentation of people with mental illness and substance use disorders at every point of the criminal justice system, from contact on the street with law enforcement, through court processing, and then moving deeper into our jails and prisons and upon re-entry. And with that overrepresentation, there are specific responses that are needed in order to assure that they can come back into our communities safely and be a part of our citizenship and move forward with their recovery. What we learned at this point and juncture is that within Ohio there are a number of Bright Lights programs out there that have been able to identify those individuals with mental health and substance abuse needs and then provide responses. Law enforcement officers trained within the state have crisis interventions teams that allow them to get out on the street, de-escalate situations as necessary, and divert from prison when appropriate. The courts have specialty dockets. Leadership here in Ohio is assured that drug courts and mental health courts have an opportunity to provide conditions that allow people to be linked to treatment. And we've got a large probation and parole population that is out there in need of services as well. One of the overarching findings of this report is that any of those interventions is only as good as the community-based services that they have to work with. And there is, unfortunately, not enough of those to meet the demand that's out there. So one of the key findings is to increase the access of individuals with behavioral health needs in the criminal justice system to those effective services. And then, as importantly, is to integrate those services with effective supervision on the local, county, and state level. And with those activities, we hope to be able to reduce recidivism, control costs, assure public safety, and assure those individuals get the care that they need going forward. Thank you. Dr. Latessa from the University of Cincinnati, who has participated in this study, will share some of his findings at this point.
Thank you, Fred. Over probably the last 10 years or so, we've done a number of large studies here in Ohio of the community corrections system. We have identified some outstanding programs over the years. We've also identified programs that were not very effective. And our goal, I think, is to try to emulate those programs that are showing strong effects in reducing recidivism, both in terms of halfway houses, community-based correctional facilities, as well as probation department. I don't think it's unreasonable that if someone is put on probation, that they receive a minimum level of services and contacts, and that there's some expectation, certainly by the public, that they will be supervised. And so I think part of what we're aiming for here is that we have some consistent and high quality standards across the state, because we have a lot of evidence that if we do these things well, we can get some effect on recidivism rates. And so I think that's where we're trying to push. It's what makes it a challenge in Ohio is that it's a large state, and that we have, you know, as you've heard in the presentation, we have all these counties that are kind of all over the map. And so it's a question of how do we rein that in within our political structure, allowing the counties to continue to have home rule, but at the same time ensuring that that there's some consistent services and programs. So that's where we're headed. Director Moore, all right. It's like a tag team here. All right, who's that? You're up, buddy.
Yeah. No, I would just like to share that the Department of Rehabilitation and Corrections feels very fortunate to have the experts that we have converging on the state of Ohio right now to help us tackle this problem. You know, today we're sitting at 50,800 offenders in Ohio's prisons. We've got to do something differently. That's 133% over our 133% of our design capacity. Whenever you are that overcrowded, it brings along a whole set of issues that make it especially difficult and challenging for the staff in the prisons to manage. So we are fortunate to have the folks from Pew and the CSG folks in Ohio using our own resources, like Dr. Latessa from UC. We've got both legislative bodies present and are on board with this study. We're looking forward to seeing the results. We're looking forward to working with them on solutions. Because if we don't do anything, not doing anything is really not an option. We are projecting by the year 2018 to have over 53,000 offenders incarcerated in our prisons. Now, you can only do a couple different things. You can either build more prisons to house those type of offenders, or your design capacity increases and you just become more overcrowded than what you already are. So we're on board with this. We're ready for solutions, and we're looking forward to working with the council of state governments to come up with an implementation plan.
And of course, I represent the judiciary, which is the third branch of government, and I was a trial judge for 7 years, and I've been on the Supreme Court for 14 years, and I am learning so many fascinating facts of this study that I think will really make a difference in how we as judges will operate. We've been very progressive in Ohio. We are one of the national leaders in drug courts. We are the national leader in mental health courts. We lead the country in CIT, so we have some good tools in place. We spend one of the highest percentages on community corrections, but we don't have good hard data and good hard evidence-based practices that drive a lot of what we as judges do. And I think once the judges can really be educated as to this process and understand how this data drives the decisions that we make and how we can make such better decisions with better data, we can all be part of the process to bring about this change. I keep looking at Texas and how large and diverse it is and keep saying if they did it, by golly, we certainly can do it in Ohio. And so with this data that is being provided and all the things that we are learning, which is just to me somewhat astounding, we have the real commitment of the judiciary. The Supreme Court is fully behind this. The Judicial Conference is fully behind this. All of the different judges associations are committed and have been participating. So we intend to do our part to be part of the solution once we have all this evidence in hand. Thank you.
I'm Senator Bill Seitz, and by way of summary of today's proceedings, it's the classic good news, bad news story. The good news is this study has proven that Ohio has, in some form or fashion, every significant component of a criminal justice system. We have state prison, we have county jails, we have community-based correctional facilities, we have halfway houses, we have probation systems. We are, as Justice Stratton said, and by the way, it's mostly due to her own leadership, a leader in mental health courts and drug courts. We have the pieces in place. The challenge for this study is to figure out, are we using them most effectively? Is each piece of that continuum of criminal justice care being used in the most effective manner? It's not unlike the debate we have in the State House about elder care. Are we putting the right people in nursing homes? Are we putting the right people in assisted living? Are we putting the right people in home-based care? That is what this study is doing for the criminal justice system. And so when we break those components down, we find what these researchers have shown us. At the prison system level, we have severe overcrowding, as Director Moore said. You have increasing length of sentences. The study shows that sentence length has increased from 26 months in 2003 to 28 months on average over just that 5-year period. So we have increasing lengths of sentences. We have far too many people that are in the state prison system and sent there for only 6 to 9 months, a very, very high percentage of low-level property and nonviolent drug offenders. And that is, as you heard from our experts, not sufficient time for these folks to get the kind of treatment that they need. So at the prison level, we have those set of problems. At the CBCF level, we have a question of whether the resources are being deployed most effectively. The data shows that CBCFs do a great job with higher risk folks that are remanded to their care, but they don't do as good of a job with respect to lower to medium risk folks, which suggests that those folks might be better attended to in a different setting than a CBCF, perhaps a halfway house. Then we look at the probation system, and we find that, yes, we have a probation system in place, but it is very fragmented, spread across 88 counties, and in many, many jurisdictions, there are subunits of probation within the county, as some of our counties have municipal probation departments from their municipal court system, and instead of having a county-wide municipal system like we do in Franklin and Hamilton, they've got 6 or 8 different municipal court probation systems. So the question is, are we being remiss in not trying to tell all those folks in the probation system, hey, look, this is what you need to do. You need a uniform risk assessment measurement. And the good news is DRC has developed that and is rolling it out. It'll be rolled out by next year. But we need to make sure that that's used at every stage of the criminal justice system, from the time you set bail to the time of the initial sentence to the time you're considering whether to revoke probation and on through, even through the parole process. So you need uniform risk assessment instruments. You need uniform standards. There should be some minimum standards, while not sacrificing local control, but there should be some minimum standards of what we expect a probation department to do. How many contacts? Who do they see? How often do they see them? Are they triaging their population in the correct way? You don't want to spend all your time with somebody that is on probation for spitting on the sidewalk and no time with somebody that's on probation for a much more serious offense? These are the kind of questions that these national experts have brought to bear in Ohio. We have local experts such as Dr. Latessa, nationally renowned. We have national experts such as our friends from Pew and CSG. And as Justice Stratton said, they went through this process in Texas. Texas had a very fragmented probation system, not unlike ours. They changed. So this is not an ideological issue. This is about two things: saving money and putting our resources to what works to reduce recidivism. What's not to like about that? Whether you are liberal or conservative, there is no person who could reasonably argue with doing things that A, save taxpayers money, and B, reduce the rate of repeat offense. And that is what we're trying to do, and we've been working at this for a long time, and I look forward to getting this final report issued, coming up with the legislation, working with my friend Representative Moran and other legislative leaders to get it done. Should have been done a long time ago. Certainly should be done sooner rather than later, given the economic challenging environment we find ourselves in. I think that's too politically correct. Given the gargantuan budget deficit that we face, it is time to move swiftly to get this stuff in place. And so today's conference is about building the consensus, sharing the data, sharing the report, and getting the perspectives that we need from stakeholders across Ohio on how best to implement these recommendations. And with that, I think we'll throw it up to questions, and anybody have any questions, ask any of us, and we'll defer it to the right person.
Senator, you yourself just made the point, this has been around for years.
Yeah.
Liberals generally like the idea, conservatives like, I'm talking specifically about not having so many non-violent, low-level felony people sent to state prison.
Right.
Every year somebody says we should do it. We report that. The public has got to be saying, why hasn't it gotten done? What is the roadblock? Since everybody ideologically seems to like this general idea, why don't you do it?
Well, I think the real thing that is happening now that's changing those opinions, all right, the changing that cowardice that has prevented us from doing it in the past. What is different now is that we now have data that shows that people who are not sent to state prison, that are lower level nonviolent offenders, actually do better and repeat offense less when they're in these other kinds of programs. And so really what we're trying to do is educate judges, prosecutors, probation departments, everybody, that this is all about promoting public safety, but doing it in the setting that is most conducive to true rehabilitation. For too many lower-level offenders, being remanded to state prison for a very brief stay is simply a short course in crime university, because they are then exposed to higher-level offenders, more risky offenders, the truly bad, predatory, assaultive, and violent. And what are we doing by exposing them to that element? We're really trying to bring research from dispassionate researchers to bear on these questions. We're finding that a lot of folks are really, their root problem is some sort of mental health issue or some sort of substance abuse issue. Aren't we better off trying to shake them of those habits than we are incarcerating them for 6 to 8 months? They still haven't learned anything. They're back out on the street 6 to 8 months later, and since they have not learned a job skill, not gotten an education, and not gotten help with their habits, they'll be right back out doing the same thing again. And so that's what we're trying to educate people to, that what we're talking about here is actually promotive of public safety. And when they got that message through in Texas, okay, Judge Roy Bean, west of the Pecos, I mean, they did it in Texas, as Justice Stratton said, okay? There are programs, earned credit programs, such as in my pending legislation, that are even broader in scope in states like Mississippi. So I think once we realize that we are now getting with the mainstream of current criminal justice research, I think people will realize that it is as much about promoting public safety as it is about saving money. But both are vitally important.
You brought up earned time in National Senate Bill 20.
Yes.
Does this study deal with earned time?
This study does not deal specifically with earned credit, but when we were just in Annapolis, Julie, for the National Governors Association, also put on by Pew, This is taking a storm around the country. I don't think the purpose of this study was to validate what's in Senate Bill 22, because everybody already knew that what's in Senate Bill 22 is something we should be doing. What they're doing at CSG is providing value added to Senate Bill 22 by looking at the systems of probation and CBCF and trying to focus on what can we do to standardize those systems. It all relates. I mean, we're going to do this one thing at a time. Senate Bill 22 is important. What they're coming up with by way of statewide standards, uniform risk assessments, better use of our CBCF dollars, that's value added to Senate Bill 22. And what's value added to that would then be the third component, which is focusing on reentry programs, what kind of barriers there are to employment opportunities for rehabilitated criminals, and that would be the next piece of the puzzle. So this is not something that you wave a magic wand and say, voila, it's done. This is a process. The process was kicked off when Governor Strickland proposed the significant elements of Senate Bill 22, and I'm working with him on that. That's the beginning. Stage 2, this report focusing on the systems that we use in interoperability with one another to deliver the continuum of criminal justice care in Ohio. And then step 3, which I think Senator Shirley Smith and others are working on, is the reentry piece, which would be a third piece that is also very, very important because, but it's a process. It's not something that's going to happen overnight. We need to move more quickly than we have moved, though, beyond ideas into reality. And I hope that our lame duck session will see some real movement on many of these issues, and I'm hoping that that's the case because you all as State House reporters know what we're looking down the barrel of, and the better we can get this out of the way, we'll get on to the really fun stuff, like where do you find the other $6 or $7 billion? But that'll be for brighter minds than stand here. Other questions?
Assuming the opinion of the legal community means something, common police judges, prosecutors, how do you deal with and not overcome opposition to some of these kinds of things that was evident in the 2008 survey of common police judges and prosecutors and defense attorneys in Ohio, opposition to treating low-level offenders, drug offenders as a public health issue, desiring more prisons, prison overcrowding is not a concern, no lesser sentences for minor drug offenders. That range anywhere from the low 50s to 75%, depending on the question. And that was primarily judges and prosecutors. Defense attorneys obviously took a somewhat different view.
Well, I think we ought to let Justice Stratton speak for the judges. I can, if you want to comment on that, but I will say the Ohio Judicial Conference has been supportive of Senate Bill 22, and they have been an active participant in this process, and Justice Stratton has certainly been a committed participant. But Justice, do you want to comment on the judges, and then we'll deal with the prosecutors later?
I think
Justice,
that
could you step to the
Sure.
mic? Thank you.
I think one of the key components of winning the judges over is education. So many of the judges, when I have shared some of the data that I've been privy to because I've been on the core leadership committee, have said, I had no idea. I had no idea. And the judges want to do the right thing. They don't want to increase the cost to the taxpayer, but they've got to deal with all their local issues. But when we can give them the tools to do their job better, I never had a risk assessment tool. I took 2, 3, 4 years to develop my own sentencing philosophy, which was different than the other 15 judges on my bench. If I had tools, if I had education, if I knew outcomes, if I knew what was the result, I could have made better policy decisions as a judge. And I have found that in working with Pew and working with CSG, we have had a real buy-in and a commitment from the leadership of all the judges' associations, Common Pleas, the municipal. We've had buy-in from the Judicial Conference. They have been part of all of the research. They've opened up all of their data to these good folks, and I think that's going to make a difference. If we can have some good hard data, that will make a difference. Secondly, Ohio has really demonstrated that it is open to change. We lead the country in specialized dockets. We have 133 in many different areas. So we have a culture among judges of looking at these ideas, being willing to try them. That was all education. I worked for 10 years giving speech after speech after. I've probably done hundreds of speeches to judges, prosecutors, defense attorneys, you name it. But as a result, we have the most mental health courts in the country. Education, that's all it really took, education and knowledge. So I'm convinced the judges are willing and eager to participate if we give them the tools, and that's what this process will do.
Justice, is one of the dilemmas that over the last decade or two, judges have gotten a signal from legislators, we want tougher penalties. We're have passed all kinds of mandatory sentencing bills. So is it possible that the judges have gotten the message, we want tougher sentences? Now they're telling, oh, no, now we want you to kind of look at these all.
I don't know that they've necessarily gotten the message. They've been handed down some sentences that have mandatories, and a lot of judges don't like them because they look at the individual, and you can look at an individual on paper, and it's a mandatory sentence, but they could be actually a very low-risk offender, but you're required to do something. So I think judges welcome this change. I don't think they'll think of it as confusing. They'll think of it as, let's do something that's more evidence-based. Give us the tools to make smart sentencing decisions. That's where discretion comes in. You can look at the same two people on paper, but they are so different in outcome and risk assessment, but we have no tools to do that. So I think if the legislature, we don't like as judges the more time for more crime sort of that, you know, the flavor of the month thing, because you're constantly adding it. I think we are in a time economically we can no longer afford to do that. I think we are looking at outcomes with research which will show us better ways to do it. I don't think you're going to have trouble from judges at all accepting this, in fact welcoming it.
Justice, can you give an example of maybe 2 or 3 pieces of data that would help a judge in sentencing time?
Well, the risk assessment tool is a huge piece. I got a pre-sentence investigation, which mainly consisted of, well, how many crimes they had committed, what their job was, what their family situation was like. But I have no training background experience to understand what did that really mean. I didn't understand until actually about 1.5 years ago, because of my involvement, that if you put a low-risk offender into a high-risk program, you get worse outcomes. Well, you think, you know, you give them more treatment, you give them more supervision, they're going to do better. But I didn't understand exactly how that worked. It was very simple when I thought about it. You take them out of their job, you take them out of their family environment, the things that make them low risk, put them in a high-risk setting. Well, that makes sense. But I didn't really have the education to understand that. And so I think that's an example of something that really I think education will make a difference on.
Senator Seitz, you had mentioned hoping that some action can happen in the lame duck session. Has a lot of this been just waiting until after the November election?
Well, certainly not on my part. I would have voted on this a long time ago, okay? And I don't really speak for how the legislative leaders determine the schedule, but I have heard from numerous people whose guesses may be uninformed, but probably not, that this will probably get some attention in the lame duck session. And while we will have squandered the better part of 18 months, that we could have been realizing the savings through the implementation of these kind of programs and helping Director Moore out with his overcrowding problem. While we will have wasted that opportunity, at least we will hopefully have done something before the onset of the next round of bloodletting in the budget determinations that will occur in 2011. So I'm hopeful that that will happen. Again, Senator Harris has spoke up positively about the need for Senate Bill 22. Of course, the governor has been a steadfast supporter of the bill. Majority Leader Hurd is a committed supporter of the bill, so we're certainly getting there. And to my colleagues that want to vote no because they're afraid of someone might get out one day early and commit a new crime, my answer to them is, well, go ahead and vote no and be a hero. And we have the votes to pass it in the Senate. I guarantee you we do. And as soon as the president decides to call it up for a vote, I think we'll have the votes to pass it. And I'll let Representative Moran speak for the House. I'm not over there anymore.
And one thing that I'll reiterate is that this conference that we're having today is independent of any existing legislation that's out there. They are not, they may be somewhat overlapping, but the report that was issued today does not have the same recommendations as Senate Bill 22. They are two different things. So we're here today to talk about something that is data-driven, that's bipartisan, that's interbranch, and we think that that's very valuable to have that kind of broad support in order to move forward all together. And that's what we're here to do today.
We have time. We might have time for one more question. Is there any assessment on how much is spent on probation and parole statewide in this high crime state?
We know how much is spent on the state probation system, and I don't have the figures right now. The problem is we do not know how much is spent at the local system, because that information is not collected in a statewide basis. You don't have the county expenditures being reported to the state, but I'm sure you can find the state expenditure from the department.
We won't be able to break, Laura, I can get the figure to you. We won't be able to break out probation from closed control, but we'll get supervision.
And then as a follow-up to Director Moore, it's my impression that DRC's recidivism rate is below national average. Is that correct? What's the recidivism? What is the recidivism rate nationally and in Ohio?
Well, it's debatable at the national level, but the figure that I've heard is close to 50%. In Ohio, we're sitting at around 36%, which is down 2% over the recent studies. You know, our folks do an excellent job once we get them in the system and after, but we got a lot of work to do. And we're not satisfied with 36%. We're not satisfied with that at all. We've got a lot of work to do, and there are a lot of changes that need to be made.
What we're saying, what the research says, it's not saying don't do anything with low risk people. It's saying that don't put them in intensive interventions for all the reasons you've heard. I think most low risk offenders are better supervised in the community. They're able to stay in their jobs, they're able to stay with their families, they're able to go to programs, and that can include a wide range of kind of programs. But I think for the most part, we're talking about keeping those individuals in the local community under some form of supervision. And in most, certainly in the bigger departments in the state, supervision can include specialized probation, day reporting. There's a wide range within the bigger departments, but it's certainly not consistent across the state.